Hey folks, we're back. I'm your host BKP and we're at Circuit World here in Blue Ridge, and it's time for Ask the Doc with Dr. William Whaley. We know we have the sun peeking over the mountain.
It's God shining on us.
Absolutely, that's okay. We understand they're going to get one of their big delivery trucks and put it in the window here as soon as possible, but we're going to power through. It's a beautiful sunny day. You know, the last two weeks had a little overcast, rain and stuff like that, so we'll just accept this as going to be a beautiful day.
Beautiful day. We're 19 inches up in rain now.
Want to thank Georgia Cancer Research Specialists up here in North Georgia. I want to thank you and the entire team over there. I know so many of them over there. That's just a great place. You got a great team over here, right here in Blue Ridge. And many might not know that as far as cancer treatment, this is a top facility. Top place.
Well, the Northside Cancer Group is the 5th biggest in the country. You know?
Right.
We're just a small part of a huge wheel up here, but we're in the mountains, and you can find us.
Well, we bring a lot of information, but, you know, I was thinking this morning, we thank them every week for the segment. We thank them as far as being affiliated with Northside Hospital, but most times I'll be the first to say, sometimes we don't stress the kind of care that's available right here in Blue Ridge.
Yeah, but this hometown group, you know, we have really good, loyal employees. We got employees been here.
Oh, you work there too.
25 years. I mean, seriously, we don't have.
I know that.
That's turnover, and the girls are from now. There's some of them are from Turtletown and
exactly
Turtletown and Creek. Ripid Creek, and you gotta admit, you know, it's interesting places to live. Turtletown and
everybody.
Stuff. Anyway,
everybody, big word, right? Yeah. Everybody needs to know where Turtletown, Tennessee is.
Right, yeah.
But thank you very much.
Yeah,
yes,
and White Path. Named after Chief White Path. All right, listen. You want me to read these? You gonna read?
Well, wait a minute. Before you read those, what I want to say to you, and we want to give a shout out to Dr. Raymond Tidman that is not with us here for the next couple of weeks. But you know, you and I have been doing this for years, and we've been doing it for years. And what I enjoy, and just getting out of the box a little bit, is we actually spoke to a viewer today. In Florida, just a little further back, friends, sorry, a viewer in Florida that said, you know what, you guys had a segment on moles and cancer.
Yeah.
And that same week, I was having a meal or sharing a meal with my family and friends, and some were talking about that, and I said, whoa, I could tell you
all about it.
So I just want to stress that there's so much information, and I want to thank you. That's my Christmas present.
That's good. All right, thank you. It's good.
Now, wait a minute, I'm not done.
That's better. If you got a case of these, I'll be taking them.
Yeah, you'll take my tabs, right?
That's right.
But I want to say one other thing. We have done, you guys, and particularly yourself, have done a great job over the years, and especially this year, in staying with COVID-19, bringing information every Friday that I'm going to say either validates things we're hearing or says, wait a minute, you might hear this, but there's a little more to it. So thank you for that. But we're getting into, and then I'm going to give you these 2 questions and go, but we're getting into a time with COVID-19 where we have a vaccine.
Yep.
All right, the FDA gave, is it emergency approval?
No. It'll be today. The panel met yesterday.
Okay.
But the FDA this is just 17 experts, of whom 4 voted against approval.
All right.
13 voted for approval. And now the FDA takes their information and they grind it up, like you were talking about the Supreme Court, and they decide either they give the emergency approval or not, and there's not a chance in the world they're not going to do it. Canada did it yesterday, and they're starting their first vaccine tomorrow, and England did it Monday and gave the first
lady, I think a 90-year-old lady. So yeah. where we're at is you know, we have X amount of positive COVID cases since February this past year, or this year, okay, X amount of cases, an X amount of recovery rate, and a death rate. We got a lot of stuff to monitor, but when I say the one thing is, you guys have talked about other health issues that are still going on. There's still people, sadly to say, that have heart disease. There's still people that have cancer. There's still people that need treatments. That's exactly where we're going.
Well, now, we got something in the back.
Now we're wondering, or we're asking, okay, with other health issues, how does that fit into where we're at with the pandemic? People have bigger questions, do they not? Cancer patients are coming to you and saying, you're saying to a cancer patient, you're sitting down, we're going to hit these two questions, and you're talking to a patient today, and they look back at you and they have another concern that they would not have had last year, and they say, well, Dr. Whaley, if you recommend this and this and this and we do this, how's that fit into the pandemic? Is that another concern? That's something that's happening, correct?
Right. Yeah. You've brought up something that's the questions are allude to, but just put this in your mind. So Tuesday night at 9 o'clock, I got a phone call from one of our cancer survivors in a big city up here in North Georgia. Son, Mama tested positive for the virus today. She got it from her housekeeper, and she's running fever and she's beginning to ache all over. What should she do? Well, 2 days before that, I would have told her, go home, take Tylenol, drink Gatorade, stay hydrated. That morning, this antibody that we've been talking about in previous months that had been given in the hospital before, and then we said, oh, it's not working in the hospital, so now they're trying it as an outpatient, was released, and the only place in the region that had it was Northside. They had gotten it the afternoon that this guy called me in the nighttime. So Wednesday morning at 10 o'clock, I called Northside to discuss this patient who lives as far as Chattanooga, and she was back in her home near Chattanooga at 8:30 that night, having gotten down to Atlanta, gotten the monoclonal antibody, the convalescent antibody, and was back up in the mountains. So this has just become available in the last 72 hours. So when we talk about something which we talked about months ago as an experiment that was tried in the hospital, we had high enthusiasm for it. I said, go donate your plasma if you've had this virus and can use it. Then they tried it in the hospital and it was too late. Didn't do much good. So now they're giving it immediately upon knowledge of a positive PCR test if you meet certain criteria. You've got to have age or some other thing, which we've talked about before. But I mean, there's not been one word about that in the news yet. It'll be in the news next week. But that hit the availability in large institutions on Tuesday night, and my patient got it Wednesday at 2 o'clock in the afternoon.
Well, I think what I'm hearing you say is, and people that have watched these segments all the way back from March when we started February, the treatment, how to approach this pandemic, how to treat the pandemic, there's been an enormous change just in this period of time with a vaccine. Now, I'm not going to take our time, but right here, to me, you broke the news to me that I think the mumps took 4 years, 3.5, 4 years to get a vaccine. That's the fastest one in the world. Fastest one. We've done this in 9 months. Yeah. Right? So 10 months, right?
8 months maybe.
8 months. So that also goes with the treatments. Now, let me bring this up. I mean, not to be political at all, but it's a high-profile name. But Ray Tidman, we've always, I think he was the first to say it. We've used the fine china.
Yeah,
we use
the good
fine china. 70 plus, 60, whatever, fine china. Now, Mayor Rudy Giuliani is in his 70s. Okay, yeah. I say mid 70s. I don't know, but somewhere in that area. Tested positive, hospitalized. This is not 5-6 days ago. Hospitalized 2-3 days. Whatever treatment, it was successful enough that he was out of the hospital, and he did a video testimony yesterday at a hearing.
Yeah, he was in 72 hours or something like that. Yeah,
and he's in his mid 70s, so optimism
Great.
Great. Let's go to the questions.
Okay.
I don't want to get away
because
from that.
they step
Right.
they step on this. All right, I'm gonna read them. There's a few words in here. That's the biggest words
What's
in
he
the
trying
world.
to say?
All right, go ahead.
No.
No.
All
Go ahead. All
My
right.
stepbrother had a bone marrow transplant for sickle cell disease 2 years ago, and they are talking about doing something more. Something more. Is it safe in this environment? Love the question, because regardless, we're going to answer this specific one, but regardless of your health concerns today, many people are asking, is it safe in this environment?
Every day I get that question.
So that is the question.
Some of them
Is it
say,
safe?
is it safe? Some of them say, is it safe to fly to Florida? And some say, is it safe to go have a cardiac bypass? For crying in the night, you don't have to go to Florida, but you got to have a coronary bypass.
Right.
I mean, seriously, this question was asked to me on Monday. I need a coronary bypass. Is it safe? I mean, my goodness, if you don't do that, you got about an 80% chance of dying. And if you go in the hospital and catch the COVID virus, you got about a 0.1 in 1,000 chance of dying. Go get your heart fixed. But anyway, this follows the question, and I know where this came from. We had last week on the liability, the chances that underlying conditions make you more vulnerable, and are you going to be on the list to get the vaccine? Remember we had a chart last week. Okay, so but we'll come back to this breast cancer question in a minute, because they're similar. But pop up that first thing about indications for bone marrow stem cell transplant. We've gone through this a lot of times. I want to refresh people's memory. The list. Now, these are non-malignant, the things that are on this list. Most of the time we're doing this for non-Hodgkin's lymphoma and various malignancies. But these anemias that are on here, sickle cell anemia, there are 30 million people or something a year that die of sickle cell anemia in the world. Most of those are African American or other minorities that have 2 doses of this sickle cell gene. If you got 1 dose, you can go in the paratroopers, jump out of an airplane. So in this area of the country, we have a lot of sickle cell patients, but this whole business of trying to cure them by gene transfer was in the news this week. The bone marrow transplant program for this disease goes back in experiments maybe 10 years, but in practicality, they said 2 years ago. I think that 2 years ago would have been very early in the kind of frequent transplant for sickle cell disease. But almost every one of these we've talked about before. We talk about giving people gamma globulin, that's the next one down below there. How about people who weren't making any blood? That's the top one. Get that one off of there, and I'll refresh your memory quickly about how you do a bone marrow transplant, and then you'll know why this person who writes the question is a little bit worried. So here you are, BKP. They're going to give you a stem cell transplant from your own bone marrow, or they're going to give you stem cells from your identical twin brother or from a sibling who you match real well. So what they do is you just go down there and they stick a needle in somebody's vein, either yours or your identical twin brother or your sister who's close to you, or even an unrelated donor that they've got off the computer. They sit there 2 or 3 hours, needle in their arm, and blood gets circulated around, comes back in, and they have sucked out the white cells that are stem cells. That goes off to a lab and gets processed. But what they do to the patient is they then give them chemotherapy, just like they had leukemia or something, and wipe out their own bone marrow, and then give them back their sister's bone marrow. Now, when they do that, you can pull that down. I love going into the murder mysteries, but there's a couple of movies where they get genetic material from the corpse. And genetic material from the corpse says that the killer is a woman when the killer was really a man. How does that? Well, because he had a stem cell transplant from his sister for leukemia or something. That's a real
That was a real Ellery Queen.
Yeah, that's a murder mystery thing. But anyway, so that's the story there. So this sickle cell patient, they're talking about doing something else.
I just want to say Columbo could figure that out. Move on.
I think he did. Anyway, but you've seen that movie, haven't you?
Yes.
So anyway, for some reason or other, I don't know what they're talking about doing. Either he has re-engrafted a little bit of his own bone marrow and they want to go back and stem cell him again, or they want to give him another dose of his sister's stem cells they've got in a freezer somewhere. What I want to say is I don't think it's very smart to try and second guess your doctor, particularly if he's up here at the very top of the mountain, and the guys that do bone marrow transplant and stem cell transplant are a lot smarter than me, you, and Ray Tidman all put together. And if they are saying we have weighed this in our mind and the hazard benefit ratio is on the side of doing this, then I'm going to tell you to go ahead and do it. And to be afraid to go in the hospital because you think you might get the COVID virus is really it's one of those conspiracy theory things, because those hospitals are so clean now that unless you're in the emergency room with somebody who's got the disease and you came off a street, you are in a bubble like that old kid that lived in a bubble. So basically I'd say let them go forward and do it. The stepbrother was extremely fortunate. He's in a tiny little group of 0.5% or 1% of sickle cell patients that have had this available to them, and listen to the people that gave it to him in the first place, because he was at the very tip of the spear, and follow their advice.
Well, I know on a daily basis, like you said, safe in this environment is big. That's in every office right now.
Yeah, they're not asking,
doctors,
is the procedure safe?
Is it safe
just
in this
on its
environment?
own? Is it safe in this environment?
My wife has stage 2 breast cancer and is supposed to start chemotherapy after Christmas, and I am worried that it is not safe with the COVID epidemic. What's your ideas on that? See, that is different. We're going in a different cancer, but again, is it safe?
Okay, here's the story. As you know, I have to go to Atlanta one night a week to work one day a week.
Right.
And I'm on the streets in Atlanta, and I'm in the grocery stores in Atlanta one time a week. I had a patient yesterday who was in Atlanta for the weekend that lives up here for another reason. And the comment that she made to me, and the comment that I've noticed, is everywhere you go in Atlanta, on the streets and in a store, 100% of the people are masked. When you go in the grocery store right out the parking lot here, I would say that 20 to 30% of the people are masked. You got that?
I want to say right now out there, for those that wonder where I stand on that, is I don't get into the political discussion on it, but my bag over there has my mask, and when I go in the grocery store, I don't look to see if there's a sign that says required. Right. I put my mask on. When I go into other stores, for your safety and I put my mask on. Okay. So I you know what I'm saying, and I agree with I understand what you're saying.
All right. So I think it makes a little bit of difference. Okay, let's go to that. Let's go to that breast cancer.
Well, I'm going to tell you why in a minute. Okay.
All right. Okay. Now we are very encouraged about the survival of patients who have cancer of the breast, taking chemotherapy, hormonal therapy, doing the appropriate radiation, staging, and so forth. But this particular graph, which says breast cancer survival by stage, is not from a medical publication. Now, you remember I was on the board of a large insurance holding company that held 5 different kinds of insurance company. This data right here comes from the actuarial insurance industry, so that they can figure out how to rate your insurance premiums for life insurance with various diseases. And if you look here, it says the 5-year survival of a patient with stage 2 node positive disease is 55%. That's not too terribly good, is it? Go to the next one. On this one, the 10-year survival of a patient with stage 2 carcinoma of the breast is 75%. 10-year survival. That's twice the interval that they have there. And the answer for that is why? You can pull that down, Emily. The why is because in prior years, before we knew what we know now, we're talking about research protocols available to you at Northside. They're available everywhere else, but we have huge research protocols. It used to be that when they took the breast off and you didn't have any positive lymph nodes, the doctor came out and said, we got it all. And if you had a tumor that was just a couple of centimeters big, not a big tumor, a little tumor, you had what would that be, 45% chance of dying of cancer of the breast because it would recur in some other organ. Now, we've been saying we give you chemotherapy for generally 3 to 6 months, and then if you got hormone positivity, you take hormones for 10 years, then you got an 85% chance of being cured. So you're talking about your wife getting a benefit of 35% chance of being cured by doing what the doctor said. Now, where is it? Where do you got that? Where do we have that graph that showed the percentage of people who die of COVID at different ages?
Is that in California?
Yeah, you got that one on the California thing
yes,
there?
I have it here. She has it on the screen.
Pull that up. We'll skip around here just a little bit. But if you look at this California thing here, Ray's always talking about most of the diseases are in the young people, right? Look at that. Look at that. All right, so the percentage of the population in California that's young is 24%. In the age group we're talking about here is 24%. Percent of the cases are 35%. And then if I had that death thing up here I was showing you, the percentage of deaths in this age group is down in the 0.76 or something. So you could pull that down, Emily. But the point is that you got a 35 to 40% chance your wife's life will be prolonged by taking the chemotherapy that they've recommended, and you've got a 2 or 3 chance in 1,000, maybe even less, let's say two cases out of 1,000, that she's likely to have an adverse outcome from catching the COVID virus going in and out of the doctor's office and the hospital every week for 6 months. Is that right? Does that make sense? If she takes this treatment, she's got to go in and out of a doctor's office or a hospital every week for 6 months.
Right.
Doing that's going to give her a 35% better chance of living. So out of 1,000, that's 350. All right? So the benefit's 350 out of 1,000. The hazard is 2 out of 1,000. Is 2 bigger?
I guess the only way I can
is
put it.
Is 350 bigger than 2?
Right. I guess the only way I can put it, there's no question here.
No, there's no question here.
Now, let me.
And this is what I think is the misinformation.
Let me say something I think fits
ahead.
in. And because you shared this in my life with me.
See that? That's tiny, isn't it?
Last summer. So we're talking cancer patients, and although breast cancer, sickle cell, my mom had double hit lymphoma.
Right.
Now, not this past summer, summer before last. Okay. We went through the chemotherapy.
It was tough.
Yes, it was.
Very tough. She got in and out of the hospital, transfused.
Absolutely.
Blood
Really transfused. Yes, in her 70s. And I want to share this for a reason. Now, I don't want to quote doctors, but you've done this many times. I was in the room when the doctor said, look, you have no immune system. It's, I want a mask. I have to tell you now. This is pre-COVID.
Yeah, this pre-COVID. This
right.
is a year ago.
I want a mask.
Yeah.
Can't hug your grandkids.
Got to wear a gown.
Yeah, you got to minimize visitors in the house, okay? This is going to be a bigger concern to you than the chemo itself. You know, you'll get through that, but so I watched everything we're doing now, okay? I'll never forget, she got to a point she felt good, and she wanted to go to Cracker Barrel. You're not going to Cracker Barrel if you don't wear your mask, all right? So she had her mask on then. And the point I'm getting at is, even after, I think about 6 to 7 weeks after her last chemo treatment, hair starting to come back, she contracted COVID. She's had that also. She's a cancer patient. I want to share this because here's somebody that's been through chemo. Okay.
And has been
chemo,
in and out of the hospital.
In the danger age.
Yeah.
Okay. And now in her late 70s, then 6, 7 weeks, 8 weeks later, she contracts COVID. She goes in the hospital 5, 6 days in the hospital with COVID. She's out. Well, she's out a long time ago. She's driving herself to the grocery store now.
Yeah, wearing a mask.
Yeah, wearing a mask, driving herself to a grocery store now, and so on and so forth. So I just want to share my personal story with the viewers and the people who are asking these questions, because is it safe in this environment? I understand the concern. When they ask that, I know where they're coming from.
Well, she'd have been dead 2 weeks without the chemotherapy.
Exactly. I couldn't agree more. Now, I want to say one more thing about the mask, okay? I politically do not, and I'm not telling you what to do, but I do not wear my mask because some politician or something came out in a statement that's political. I wear my mask in the grocery store because my mom, you replace my mom may need to go to the grocery store, may not have somebody that can go for her or whatever.
Right.
My mom may need to go to the grocery store. My mom, your mom may be going through chemo, or your dad or your brother, and their immune system is very low, and they need to go to the grocery store in these concerned times. And the last thing I need to do is go in there with a cold or anything, or this virus. So do you understand where I'm going with that? I wear my mask in public places like that because, your mom or dad or your brother that has, you know what I'm saying?
Right, exactly. And the other thing is, if you're not wearing it, and let's say if you're not wearing it, then you're putting a degree of fear and some psychological stress on them. Right. Not only are you protecting her from getting the virus, but you're making her anxious and nervous, and she's 75 years old, and you don't need to make her anxious and nervous.
I don't want my dear friends to say, I'm in fear of going to the store and I need things because I'm afraid to go out. We need to have respect for that fine china and those ones in our country at this time that are not sick or ill with COVID that have other health concerns. So I didn't mean to get way out there on that, but you understand where I'm coming with that.
Yeah, now we were asked last week, two separate people, basically the first question came out of this, who's going to get the vaccine first?
I want to get that as a wrap up today because I agree with you. I want these people to hear from you. What's the priority list?
Well, we're going
how fast, how many?
We're going to show something else first, because you remember the virus, the first people to get the vaccines that will be available in this country now, not the Chinese vaccine that people in Uganda get, and not the Russia vaccine that wasn't tested, but our vaccines, which are Moderna and Pfizer and Johnson & Johnson and the rest of them, will be available probably. People may be getting them by Monday.
Okay.
I mean, if they approve it today, it might be Wednesday. But I mean, I think next week you'll be seeing some healthcare workers get the vaccine. And I said before, I don't think we're going to have a meaningful number of people in the country vaccinated before May or June. And I think we'll be doing this in January of 2021 as the immunity goes down, but we're going to be in a better shape. But this next one, pull up that thing about the nurse. Within 48 hours of starting the vaccine trial, vaccine administration in England, there was a publication about adverse allergic reactions of people who had bee sting anaphylaxis, penicillin, and sulfur drug anaphylaxis, and they put out a blanket statement that they did not believe that people who had had anaphylactoid reactions to the vaccine should take it until they had a little more data to come out. And then immediately after that, which was then, that would have been Wednesday night, this headline right there, nurse shares COVID vaccine side effects from the trial, hit all the news media, even the fake news and even Fox News and everything else. And this woman came out and discussed this rash. She had no reaction from the first injection. You can pull it down because I want to talk about it now. She had no reaction from the first injection at all, except a little bit of a sore arm. She ached a little, and she thinks her temperature might have gone to 99 that night, and she took some Tylenol. 1 month later, she got the second injection, and she describes a very painful arm, a temperature that went to 104, a generalized skin rash. She took Tylenol before she went to bed. She woke up at 3 or 4 o'clock in the morning. That's when her temperature was 104. She took Tylenol and ibuprofen. And by the afternoon of the next day, the temperature had gone. Her arm was still sore, but she had this funny rash. And so it put a kind of a scare, I think, into the news media about, my goodness, this is a big deal. Well, first of all, there were 44,000 people in that trial, and this is one. And second, they've gone back and looked at her case she didn't know if she got the placebo or if she got the real vaccine. So she didn't know that she had the placebo or the real vaccine. So they went back. She said, well, I had to have had the real vaccine to have had that local reaction. Well, she didn't even know, and she's out there blasting the vaccine. So they went out there and they checked all of her blood and everything else, and she had some sort of a viral infection that gives you a rash that they were able to identify out of her blood. And so the legitimate side effect she had of the vaccine itself was probably the sore arm. So I was saying, don't be frightened by people who are crying Chicken Little or the earth is falling or whatever it is. And I have said to people that if you're not a healthcare worker and you're not fine china and you're not a fireman or a first responder, wait 8 weeks after it starts, and all of this stuff that's going to be side effects, if it happens, I'll get them. The sheriff will get them, or the nurses will get them, and you'll know about it within 8 weeks, and then take that vaccine as quick as you can get it.
I know we got to close, but I want to cover this one thing. Distribution. Now we have throughout the media there has been a lot of, I call it panic reporting, that okay, we got a vaccine now, and the distribution channel, and if you get, if you're watching out there, you're like, there's a vaccine, but they don't know how to get it to Blue Ridge, Georgia, right? That's what you hear. Now here's what I'm thinking the other day. Now at Christmas time, and I say this tongue in cheek, if Omaha Steaks can put a dry ice pack and get me 10 prime Omaha Steaks frozen to my house
with the apple tart
exactly.
and a ground hamburger and 4 pork chops for $59.99
and get it in a box frozen.
And you just got to use Sean Hannity code, and it'll be on your doorstep in 48 hours.
Right.
And it is.
But the thing is I use that for an example because then you see that commercial this time of the year because everybody has it. Free publicity, their ad for almost. But you use that, and then as soon as the newscast you're watching comes back is big concerns in the distribution of the vaccine. Will we be able to get it to? Could you talk to that?
Well, we did about 3 weeks ago.
I know, but they don't stop.
I showed the pictures of those big refrigerator trucks that they have purposed for this. I think the military is going to be moving some of them, and I'm sure FedEx and UPS and Amazon, everybody else can move in others. But those trucks are able to hold millions of vials in there if they had them at that temperature, so that they don't have to be individually packaged in little bitty boxes of dry ice. And then it's going to get to somewhere like I think it's Memphis, Tennessee, where UPS is, and somebody knows what he's doing is going to break that up into packages this big. We get 4 or 5 packages that big every day packed in dry ice at our office because all of our drugs have to come that way. They're all in dry ice. And we order the drug. Matter of fact, yesterday I ordered a drug for a patient who needs to be treated. Wednesday I ordered a drug for a patient who needs to be treated immediately. They generally tell you have to wait 7 days so that they can get the supply chain. You got to pay for the drug, find out whether Blue Cross is going to pay for it or not. But if we have to have an urgency, I ordered it Wednesday, and the drug will be delivered probably by 9 o'clock to the office. The guy will get it at 11 o'clock today. And it's coming all the way from Indiana or somewhere.
You're not concerned with the distribution supply chain for this vaccine?
No, from the point that it gets to Blue Ridge and then gets over to the health department, they certainly got to train those nurses over there how to,
administer.
The minister's fine. I think it could stay out of that stuff about 3 hours or 6 hours or something. So you want to get it to the place it's going to be used in dry ice.
All right,
but that's not a big. That's not a mountain that can't be climbed, and these people know how to do it.
Close us up.
Well, one more time. I think Ray's right. The death rate is so low in kids, schools ought to be opened up, and I want to do that again. I'm still disappointed that they're shutting down sporting events at the high school level for minor reasons. And if you got a Denver football team playing with no quarterbacks, it just says that we ought to be living our life wearing our masks, and that everybody who's over 60, and I won't say 60 instead of 70, but everybody who's over 60, who's a little overweight or got high blood pressure or something, needs to be real careful about their masks and stuff. And if you're over 70, stay really careful.
I'll take that. Hey, folks, thank you very much, North Georgia Cancer Research, affiliated with Northside Hospital. We appreciate them so much. And let me just say to you out there, I really appreciate the questions you send. And we do understand here when you say safe in this environment. And we know that's what we're dealing with anybody that's dealing with any medical issues. The treatment, safe in this environment. Dr. Whaley has answered several of those questions, and he will answer others regardless of what you're dealing with at this time. Don't forget, FYNTV.com, Ask the Doc. Okay, you can go in there and you can hit Ask the Doc, and all of his episodes are on there that you can watch and share with your family and friends. You can find our YouTube channel, FYNTV Fetch Your News YouTube. Under the playlist, hit playlist, Ask the Doc, and they're all there. You can share with your family and friends. And Dr. Whaley, I appreciate you very much. We have a lot to discuss with the All-Star Political Panel this morning, and they're over there buzzing around like bees at a hive.
You going to talk about football, or are you going to talk about something else?
We're going to put it together. We're going to put a little bit of everything together, and it is up. Circuit World of Blue Ridge. Thank you. Right after these messages.